There we go. Okay, so Michelle and I are going to talk about neurodevelopmental outcomes in children following congenital heart disease surgery, kind of in this early childhood period, so like 0 to 3 years old. For context, my name is Nicole. I'm a PT in the Children's Hospital inpatient, so I'm working with a lot of these children before surgery and after surgery, and I also work in our brain care clinic.
And I'm Michelle Swain. I've been a speech pathologist for 30 years, the last 12 at UW Health Kids, and work in the NICU, the pediatric cardiac ICUs, and throughout the hospital. So I get also the joy of seeing them inpatient through the lifespan of these children here during their childhood. My apologies.
So for family members here, or any of you who may have gone through surgery, we don't have to tell you that this time frame around like that surgery or anticipating for surgery is a big deal, right? Like there is a lot of fear around that, more than probably we can kind of understand. Our goal is, as therapists and kind of providers in this kind of setting, is to kind of help support that development, hopefully to prevent, but at least mitigate a lot of these challenges that can occur starting at the time of birth. So as Dr. Boyd Anderson had kind of referenced, more than half of these children will likely experience some sort of neurodevelopmental impairment kind of in this early childhood period. So that means how the brain grows, how it organizes itself, how it functions. So we can't talk about the heart without talking about the brain, especially in children, because how the heart is functioning affects how this brain is developing, especially in little babies and children as they kind of grow and progress. So some of these changes that are happening at birth or prenatally because of the blood flow that is kind of being provided to the brain. Differences in just how that brain is developing overall, and then if there's additional complications like prematurity, or if there's other kind of body systems that are involved, these kind of things can all add different layers that can kind of affect that overall neurodevelopmental picture. When a child goes through surgery, there's additional stressors that can kind of impact this. So there's changes in blood flow and how the brain is receiving oxygen. When children go on cardiopulmonary bypass during surgery, an essential thing that can kind of lead to like inherently some inflammation and some other risk factors. There can be fluctuations in blood pressure, so that's changing like the force or the flow of blood to the brain. And then post-operatively, these kids are receiving medications to allow their body to heal and recover, but that also kind of decreases how much we're allowing the brain to kind of play and interact or receive stimulation. And then finally, there can be nutritional challenges as well after surgery, both kind of from this healing process that are necessary for the body to recover, but again, that can affect how this brain is developing and growing. So it's not to say that, like, again, all these things are going to happen. Most of these children do very well, and the children that do experience some of these things, there are things we can do about that, and that's what we're going to really talk about today.
Yes, I mean, we're here to reassure you that there are many reasons for hope, even though we tended to start with all of the scary parts. Early childhood is a period of really remarkable brain adaptability. Neuroplasticity is the brain's lifelong ability to reorganize, to fix itself, repair some structures, functions, and form new neural connections in response to the things that it experiences. So we want to capitalize. This is an excellent time to capitalize on that neuroplasticity and the ability to build new connections by enriching our environment. It happens throughout our lives, but the time when our brains are the most neuroplastic is in youth. Although it may be well-meaning advice that you may receive to reduce your anxiety as a parent, or to try to help you feel less stress when people tell you, let's just take a wait and see approach, that is really not particularly helpful if you have concerns for your child, especially in this population, because it is such a complex area and there's so many factors. You may actually need specialists to help support you in this, and therapies like us and others that you'll hear from today are really able to help individualize the specific approaches that may be most beneficial for your child to help keep that momentum moving forward.
So we start talking about motor development. So these big gross motor skills, many of them are listed here on the board, and fine motor skills, because these are the first things that families often notice. They're the easiest thing that we can measure early on as well. So about half of children may experience a gross motor delay or difference, and about a third of children will have differences in fine motor development. These will often improve with age. So some of it is with things that we're going to just talk about families can kind of do on their own at home, and some of them can be with supportive therapies. We've talked about kind of some of the reasons, and again, we do this not to kind of like bring more kind of like doom and gloom to this, but to say you're not alone. Like, right, this is not your child's fault. This is not your fault as a family member. This is just science. This is the anatomy. This is the way the body is developing. In addition to kind of some of these like physiological changes that happen, children who are in the hospital for even a little bit of time, but it's certainly like prolonged hospitalizations, it just changes how much opportunity they have for these experiences. It changes the frequency that they would experience these. There's more time that they spend on their back, and not necessarily on their back in like a playful position, but we're adding the weight of lines and tubes to them, right? And all for good necessary measures, because we want these kids to survive so that they can develop. But we are trying to kind of fix these things and kind of mitigate these things right from the start. And then again, if you've been through surgery, you know there's some activity restrictions for a short period of time after surgery that can also kind of change some of these skills. So things that kind of all of us can do to kind of support motor development. We're looking to support the positioning of a baby. So especially a newborn baby, if you think of a newborn baby kind of curled up in this fetal position, their body is meant to kind of have their arms and legs bent. They're meant to be kind of curled up into this tight little ball. After surgery, we kind of stretch them out, right? We put weights on them with these lines, with these tubes, so they can't do that. There's a reason why babies are meant to do this. This helps the development of their muscles and their bones and their joints kind of develop so they can do these later developmental skills. So the role that we're playing in the therapy alongside the nurses and the physicians is to, as best as we can, kind of accommodate everything medically that's going on to put them in these positions. These children, if they're being moved in the hospital or when they can be moved, are often going from a crib to being held in the chair next to the crib, right? There's not a ton of movement versus if this baby or another baby who's at home at the same age, you're moving them through the house. You're taking them, you know, to the kitchen, to the living room, to the bedroom, and all of that movement that we are doing to them kind of helps develop their brain and their motor function on how they can kind of adapt to the world and kind of change their posture and position. So again, these are kind of activities that when these babies are able to kind of do these things, we're helping them do. We want to encourage active play as much as possible. So there's a lot that we can do to the babies. We can move their arms and legs, right? But the soonest we can allow these babies to actively move on their own, that is more important for them to kind of build these connections, to build their own strength. So floor time, kind of minimizing the use of containers, so minimizing use of swings and bouncy seats and exercisers and jumpers and all these wonderful things that we have. It's not to say these things are bad, but these kids after heart surgery or preparing for a heart surgery are going to benefit more from kind of this active play where they can really control their whole body. Tummy time is a big thing we kind of talk about in the therapy world with families. I always say if any of us as an adult had an open heart surgery and then someone came in, you know, a week later and it's like, let's roll to your belly now, I'd kick them right out of the room, right? But we're doing that to these babies. It's safe to do. It's endorsed by our surgeons, but it's terrifying, right? It's terrifying for families. So some of our goal is making sure you feel comfortable doing this. But the reason is there's so much development that happens in this position. There's strengthening of kind of like the shoulder girdle and their upper body, of head control. It allows these babies to kind of like use their hands before they're able to actually like manipulate things. So kind of is setting stone for all these building blocks of things later to come. And then especially for children who have kind of single ventricles or staged procedures, really promoting leg strength and kind of power in their legs, especially if their thigh muscles is really important. This is going to be the big muscle pump of their body and really help kind of like work with their heart kind of for all these things. So doing activities as kids get older, riding a bike, jumping, climbing stairs, climbing in general are going to be really important for them.
It's all really important for all of the things that a speech therapist wants you to do as well. But 20 to 30% of children may present with speech and language differences after cardiac procedures. But the incidence of speech and language problems in the general population of children in the United States is 8 to 10%. So there is an increased risk, even with other children who have not experienced this medical trauma, but on top of that, there are additional challenges. There are expressive and receptive language delays that can happen. Some of these challenges may not become apparent until the developmental expectations have increased. And so we may, as a speech therapist, notice some things early on that we can foster, and parents may not know to do that. So we really value the opportunity to partner with you early in the hospital stay and early in your child's life to continue to help you be your child's first, best, and earliest teacher. It's important to know that early language delays do also often have an impact on later literacy skills. So again, that wait and see approach that I mentioned earlier can have more broad repercussions. We talked a lot about all of the different risk factors for why these problems may happen, and so most of them are things that are necessary medically. That restriction of movement keeps a child from feeling like they can make their voice happen early on in the hospital stay. They don't get to do some of the vocal play that naturally happens when they're moving. Superimposed upon those risks are lack of exposure to incidental language that you might typically get in the home environment. Everything that's said around them has to do with vital signs, with medications, with how their bowel movements are early on, and that's not good for early language development for children. Toddlers like poop jokes. But when we are talking about trying to enhance and enrich those early opportunities for language development, it really comes down to trying to overcome the negative experiences that they've had in the hospital. We know we can't fully replicate what they would be getting outside of the hospital or in other typical developmental areas like preschool programs, but that is ultimately our goal. Early in the stay of a hospital stay, there's also a well-intentioned, let's not wake the baby kind of approach. Keep them calm, because we know that it's hard when they wake and they have trouble settling. They may have pain and nausea that keeps them from tolerating all of that active play. So it's important to find other ways to provide that language input. Another area that's important for us to monitor is hearing. There are hearing differences that can be common in children, especially with certain genetic conditions, those who have been on ECMO, or even as a side effect of some medications. And hearing loss may be something that is more gradual at its onset or become progressive. And so even if a child passed their newborn hearing screenings, if you have concerns about your child's speech or language, starting with a hearing evaluation is never wrong. We can see changes in concentration. We can see the fact that a long hospitalization may actually involve early limited interaction during very critical developmental periods, and reduces things like peer and sibling language modeling, which is also really essential for early language development. And I want to acknowledge that most of these are not things that are immediately modifiable by our caregivers in that moment, but there are some areas that you as a family member can continue to build upon. It's important that we try to incorporate language into all of our everyday routines. Narrate your life, narrate everything you see around you as you're moving through the day, model language, read, sing, read, play, model clear speech, and don't use baby talk, but do use short sentences that help your words stand out and be clear. Reduce the background noise of television and other sounds that can make it harder for your language to be really salient for your child. We, in speech therapy, really encourage responding to all communication efforts. So that means facial expression, body language, voice, even paying attention to their vitals when they're on monitors, can help you recognize and become an expert in reading your child's cues. And that responsiveness builds bonding, it builds connection, and it continues to make you the expert in your child. We encourage early use of sign language. Sign language and picture boards are shown to actually reduce language and behavioral frustration and improve language development and growth. So it's not going to be any negative thing if you're asking your child to use and learn baby sign language or continuing to build on that. It is actually a really important and positive thing you can do for your child early on. Language strategies like taking what your child says, repeating it, adding a couple of words to it at a time is called language expansion. Please use things like communication temptations, where your toys are put in a box that they can see through, but they can't open on their own, so that they get to ask for assistance. It gives them reasons to have to communicate, as opposed to us tending to want to jump in and make things easier for our children all the time. And using that wait time, a pause, to give them a chance to do communicating behaviors that you can then respond to, rather than jumping in to ask again, repeat the direction, give them choices right away. Those are things that can kind of hinder and interrupt the processing that they may be doing to try to get their language going in that moment. Sing, play. Did I mention reading? Those are the work of childhood and the best way for them to learn, because they are repeatable, predictable language, and they can be paced for what the child actually needs. And they build attention. They build the ability to sit and look and listen. They build patience, and those skills are going to be life skills, right? Please limit screen time as much as possible, and that includes phones and YouTube. There are better and worse shows out there, and I won't lie and say my kids never watch TV, but look for those shows that are channeling Mr. Rogers, as opposed to the ones that are very overstimulating. And the most important thing you can do is actively play with your child using low-tech toys with simple parts. Those toys tend to encourage the most descriptive language, the most creativity and imagination. And don't have every toy out at the same time. Use fewer toys at one time to really work on focus and attention and imagination. And if you're struggling, if your child seems to be struggling, a speech pathologist can be a very helpful coach to guide families through this journey. Cognitive skills include attention, problem solving, memory, learning, self-regulation, impulse control, among other skills. And I'm only going to briefly touch on this because you're going to hear more in-depth discussion by our neuropsychologist shortly. But I cannot pass up the opportunity to emphasize the interconnectedness of our higher level language skills and our cognition skills. We think in words and pictures. We talk to ourselves to help us solve problems, to settle our fears. We talk ourselves into or out of something. And we learn strategies to help us concentrate and persevere even when there's something we don't want to be doing at that moment. Calm our heated selves. We rehearse things so that we can remember them later or make a mental movie. And for all of those reasons, it is so important that we continue to support early language and cognition development so that we build those later foundations for cognitive resilience and learning. So don't always let them win the game. Cultivate an ability to entertain themselves and play independently. Set up problems when you're playing. Maybe knock some toys down, create things that they have to learn how to manage some emotional regulation with. And if you're having, again, concerns about your child's ability to do these things, occupational therapy or speech therapy may be helpful to come up with some more specific strategies for your child.
And keep your brief.
Why is feeding so difficult? I taught for a living. What do you expect? Feeding problems are pervasive and complex in this population. And so, again, families that are struggling with this know you are not alone. The why is very multifactorial, and we've talked about most of those. Many of them are up there on the board right now, but one of the biggest ones is to remember that feeding is an exercise that requires strength and coordination, stamina, all of which are going to be impacted by cardiac surgery and the restrictions that we face afterward. Oral aversion is very difficult to overcome when your child might be put on a negative formula, the negative tasting formula. And so we want to be sure to know that early feeding challenges can impact later feeding development. And it's a difficult area for families to try to navigate without support or resources. And the typical advice like, oh, he'll eat when he's hungry, also does not apply. And in this case, an ounce of prevention may be worth a pound of cure. When kids are not eating, we still want to expose them to touch, to see, to smell foods. We encourage the toddlers to help with food preparation if they can. Using what is called responsive feeding strategies lets the child's cues guide what is happening to them. We know that forcing a child to eat backfires and can worsen the problem. And so we really want to make sure we keep it as positive an experience as possible. Swallowing safety may also be one of the reasons that that a child may be avoiding eating, and that may require more specialized evaluations like swallow studies that a speech pathologist could do. Tube feeding may be a necessary tool while working toward oral feeding, and it often is, especially in the early months. We work to guide progression of skills from bottle and breast to more solid and table foods, but the tube feeding can support the adequate nutrition. Sorry, I just lost my notes. Thank you. Most children do not require feeding tubes for a long term in terms of years, but they may need support for several months. And that, I think, is something that many families don't hear early on and understand, that this is a very common problem due to many medical issues, not due to something that they have not done appropriately to feed their child. And we want to recognize that it is an incredibly stressful thing. Progress happens, but progress is more gradual than any of us would like to see. And most will require ongoing feeding therapy after surgery. Sorry.
No, I thought the feeding would go really long. That's why I said it there.
Because it's important. I fixed it.
So we won't get into a lot of this. Dr. Ferrazano had kind of talked about the cadence that we see kids in our clinic, which matches kind of the recommendations from the American Heart Association. These kind of key periods of time at infancy, toddlerhood, preschool, and kindergarten are specific because there's like new skills happening then, right? So we want to kind of capture these, and we want to try to catch any issues that are happening so we can do something about them so that they're prepared kind of for that next phase of life. We've kind of talked about the role that therapies can play in these different areas, and also really want to stress the importance of you as the family in these areas. So there's different ways that therapies can kind of be involved. We've talked about like whether you have a choice in it or not. They're going to see you in the hospital, right? And kind of how often they see you will kind of depend on the need, but there can be, if needed, resources in the community through like your early intervention program. There could be more intensive kind of need through like an outpatient clinic closer to home. And then as your child kind of reaches 3 years old or older, there could be services within the school system as well if needed. The one thing we kind of want to touch on is therapies in each of these settings can look different. So therapies in the school are there to support the child, for example, in the educational environment. So they may not be addressing things like feeding or nutrition. and we'll let our kind of school liaison talk about some of those things. But just to know, not all therapies are equal. Like which therapy your child needs, if they need it at all, kind of might be unique. But the most important thing, you as the family are the most important. So trust your intuition. If something feels off, you know your child best. So that can be the point, whether it's kind of through these like natural checkpoints or not. Ask questions, request further kind of assessment if needed. Try some of the things we've talked about. And if you're not seeing kind of progress on your own, that's where kind of additional supports could kind of come in.
So we hope that you have been able to find a few kernels, a few nuggets of some helpful information in this presentation. You are not alone. Neuroplasticity is real, and it can be very helpful to have really enriched and supportive developmental activities early on, because they will have long-term benefit. This portion focused only on this early childhood time, and you will hear more about later developmental levels and long-term planning. But we really want to know want you to know that we celebrate your role as your child's best teacher, strongest advocate, and expert. Your kids are all fighters, and we are blessed to get to work with them. And you're amazing children, amazing families, and inspire us on a daily basis. And we are honored to get to travel part of that journey of 1,000 steps with you. As we open up the little bit of remaining time we have for addressing any questions, we will share some resources that you may find helpful to monitor your child's development. Oops. And why is our slide not advanced? There we go. We encourage using some well-researched and supported resources for your references. Dr. Google does not always do a great job. And remember that these are tools to maybe help you recognize a pattern, not to diagnose any disorders in your child, but can serve as a way for you to open discussions with your physician supports to get the appropriate referrals if you're concerned. All right, I'd like to open the floor for any questions.